All right, it's Johnny Nelson here with the Bone and Joint Surgery Clinic. So I wanted to, we got Jack here, my assistant. We're going to go over a few what I call phase 1 exercises. So these are essentially exercises I want you to start about 5 days usually after your surgery, often after shoulder scope surgeries, or even after a shoulder replacement surgery. The main goal here is we expect some stiffness in the shoulder to start setting in. And these exercises are essentially a way of telling your joint that we operated on that it's a joint, reminding it it's a joint and it needs to move a little bit. Even though we don't at that stage expect or want you to do things actively with your shoulder, meaning move it under your own strength, we do want a little bit of motion at that joint, just what we call joint gliding, right? So the main goal here is to say, for instance, we worked on this left shoulder. It's been about 5 days after surgery. The main thing we're going to be doing is keeping this operated arm loose like a noodle. So most of you will have a nerve block. You know what that feels like, where the arm almost feels like it's somebody else's arm or it's dead. And even though your nerve block will be worn off by that point, we want you to almost act like it's still working, meaning that we want this arm to stay limp and loose. We don't want you to engage or fire any of the muscles in the arm. And that means that you have to use your other arm to help glide this arm. So the main way you do that is, first of all, I want you to either lay back. You can prop yourself up a little bit if you like, or you can lay completely flat. It's kind of up to you. I tell patients, once they're out of the house, they can even do this sitting up in a chair at a restaurant, for example. You can still joint glide in those locations. The main thing you're going to be doing is taking your good arm, right, so the right arm on this occasion, and basically grabbing the outside of your wrist over here, right? So remember, this arm here, freshly operated on, is going to be nice and limp. This arm right here is going to be doing all the working. So think of this arm as a loose noodle. It's just being dragged along for the ride. And really all you're doing here is with that arm is you're going to glide it back and forth a little bit. This is really nothing fancy. So there's nothing fancy about this. There's not a lot of complexity to this movement. It's really just moving the joint back and forth, focusing on keeping the shoulder that we worked on nice and loose. And in terms of how far you want to go, I usually tell patients they can go as far as they're able to tolerate. You can even bring this arm up to about the level of your ear if you can tolerate that. Now, I don't want you to worry too much about how far you're getting. The main goal here is repetition, doing this several times a day, up to 5 times a day, but very brief exercises. And just doing it a few reps. If you get tired, if it starts to ache, just stop it right there, come back to it 3 hours later. So this is usually what I call a phase 1 exercise, and it basically starts about 5 days after surgery up to about 4 weeks, sometimes 6 weeks after surgery. So if you have any questions about that, around the time of the surgery, before the surgery, and your first post-op visit, feel free to ask me, ask your therapist about this, but hopefully this kind of clarifies what we call joint gliding or phase 1 exercises.